Hello, this is Debu Tripathi from Cure Magazine, and we are at the San Antonio Breast Symposium. It's going on, winding down now, and today there was some interesting updates on Herceptin, a drug that has been on the forefront for quite some time. It was 7 years ago that the original data was presented on early stage breast cancer, and an update of the US trial. The one that was done here in the States, it was one of the larger trials. It was a pooled analysis of 2 studies was presented, and that confirms that Herceptin is clearly saving lives. There are 40% fewer deaths and about 35% actually fewer deaths and about 40% fewer recurrences. So what that means is that with longer follow-up, the certainty that we have with the data is even greater. So we've already known that it saves lives, we just have a more precise estimate. And one interesting side note about that is the statistician, John Bryant, had to argue with the FDA to pool the trials and present them early. And it took a long time to argue that, but that saved a full year from having to wait by pooling the information. So it really got out early and influenced practice back in 2005. 2 other studies looked at the duration of Herceptin. One compared 1 year to 2 years. It didn't show that it was really any better for 2 years, so 1 year really remains a standard. Another study looked at it for less time, for 6 months, and it showed that maybe there were worse results, especially in patients that got Herceptin after chemotherapy, which actually isn't the practice here in the United States. Herceptin overlaps with part of the chemotherapy here, and in that group it didn't seem to make as much of a difference, although it was borderline statistically inferior. But why is that important? It's important because about 10, maybe 15% of patients will have a drop in their cardiac ejection fraction. Even though they may feel well, it may drop, or they may have mild symptoms, and those patients may have to discontinue early, and sometimes the physician and the patient struggle with, well, I've only been on it for 3 or 4, maybe 6 months. Should I stop it early? Am I really giving something up? This information at least helps us balance that and make an estimation as to whether it's a reasonable thing to do or not. So the area of HER2 biology is very important. We're only talking about Herceptin, but there are other new drugs available. Not much update in San Antonio about pertuzumab and TDM1, but those are clearly new drugs in the armamentarium as well. So I would like you all to join us again next year. Even though we are winding things down here, there may be a few other stories that you will hear about online. And next year we will be reporting back to you again day by day, giving you the important aspects. We will certainly be following this with more online perspectives, both from the Cure team as well as other experts in the field. So stay tuned.